The treatments for headache range from, of course, prescription drug treatments and over-the-counter medications of the sort of type that most of us have heard about, ibuprofen, acetaminophen, and so forth, so-called anti-inflammatory drugs. But it turns out there are many natural treatments for headaches that, when compared to those over-the-counter drugs and even some prescription drugs, appear to be easily as effective and in many cases more effective than the typical drug treatments, many of which can carry side effects. That is, the drug treatments carry side effects, whereas the natural treatments appear to not carry side effects. There are certain herbs and oils, for instance, that far outperform non-steroid and anti-inflammatory drugs for the treatment of headache. The combination of peppermint oil, eucalyptus oil, and these are basically in a ethanol suspension. Again, people are not drinking these essential oils. I want to be very clear. They are applying these to the skin around the area that's in pain, in particular the temple and the foreheads. So this combination of peppermint oil and eucalyptus oil applied to the skin allowed people to increase their cognitive performance while under pain, and it had a very muscle relaxing and mentally relaxing effect. Acupuncture, which of course has existed for thousands of years, has been used very successfully to treat headache and other forms of pain, so much so that many insurance companies will now pay for acupuncture as an insured practice. Not all, but many will. And in addition to that, the scientific community is starting to understand mechanistically how acupuncture works. The precise insertion sites of different needles lead to activation of sensory neurons and their downstream pathways in ways that can potently reduce inflammation and that can be used to potently reduce the activity of certain muscles. For instance, muscles in the forehead and temple. That has been shown to greatly reduce pain, in particular headache-related pain and back-related pain and some other forms of pain. Thanks to thousands of years of acupuncture and the maps of different insertion sites, we now know, or I should say people have long known, and people in the West are starting to adopt the understanding that acupuncture, yes, indeed, it really does work for relieving pain. And laboratories, both in the United States and elsewhere, are starting to find the underlying mechanisms. And those mechanisms include deactivation of the pain pathways, activation of some of the parallel pathways that assist in shutting down pain or in relaxing the muscles that are causing tension-type headache, as well as activation of neural pathways that impinge on organs that then cause or reduce the release of molecules into the body that give us the experience of pain. So reduced inflammation and, in many cases, increasing anti-inflammatory pathways. Now, the last thing I'd like to talk about in terms of relief for headaches is curcumin. Curcumin is often also referred to as turmeric, and turmeric is a root, and curcumin is one of the key components of that root. Curcumin is known to have very potent anti-inflammatory properties. Curcumin has been shown to be effective as an anti-inflammatory and has been shown to be very effective in treating different types of headache, in particular migraine headache. Curcumin, when taken at dosages of about 80 milligrams, although for those of you very sensitive to curcumin, probably as low as 25 or even 50 milligrams per day, in conjunction with, although not necessarily at the same time, but taken daily alongside omega-3 fatty acids at 2.5 grams per day, led to significant improvements in migraine and other forms of headache, meaning both the frequency and the intensity of the headaches that occurred was greatly reduced.